Hello everyone. Have you ever gone for a simple blood test, thinking it's just another routine task on your to-do list? Many of us do, especially as we enter our 60s, 70s, and 80s, when these regular exams become essential for maintaining good health. But here's the thing. Small choices you make right before your blood test, things that seem minor, even harmless, can actually change the results. Imagine a morning cup of tea, skipping a medication, or even a short walk outside, altering what your doctor sees in your blood. These tiny details can make the difference between a clear picture of your health and results that cause unnecessary worry, repeated tests, or even an incorrect care plan. By the time this video is finished, you'll know the top 10 mistakes to avoid before a blood test, and you'll understand how small adjustments can give you results that truly reflect your health. And stay tuned for error number 10. It's one that most people completely miss, yet fixing it can save you a lot of stress and extra appointments. Error number 1. Not preparing your body properly, eating or drinking beforehand. Many people think they've fasted correctly, saying, "I went without anything for 8 hours." But often, nothing includes a hot drink, herbal tea, flavored water, or even a small piece of candy on the way. At first glance, these seem harmless. Who would think a sip of tea or a tiny candy could matter? Here's why it does. Any taste, even without calories, triggers your body's digestive and energy systems, signals your pancreas, liver, and other organs to prepare for incoming nutrients. In younger bodies, these signals are short-lived and don't usually cause major changes. But as we age, our bodies respond more slowly. That little sip of herbal tea or a chew can temporarily raise blood sugar, insulin, or fat markers, giving a misleading snapshot of your health. Example: Mr. Thompson, 78, was very meticulous about fasting, but admitted he had a small fruit peel to curb hunger. His blood fat markers came back abnormally high. When we repeated the test after a proper fast, everything was normal. A tiny piece of fruit caused a big change. Fix: stick strictly to plain, clear liquids during your fasting window, usually 6 to 8 hours before the test. No coffee, tea, flavored water, juice, candy, or chews. Only water is safe. Tip: if you're committing to this, write "pure liquid" in the comments below. It's a small habit with big benefits for accurate results. Error number 2. Skipping your regular medications. Some patients think that skipping their morning medications will give a natural test, but this is a mistake that can misrepresent your health. Daily medications for thyroid, blood pressure, heart health, or mood regulation maintain balance inside your body. Missing even a single dose can temporarily throw off blood pressure, hormone levels, electrolytes, and other important markers. Example: Mrs. Patel, 68, normally manages her blood pressure well. She skipped her morning pill, thinking it wouldn't matter. Her sodium and kidney markers looked abnormal, leading to extra testing and anxiety, only to discover it was just one missed dose. Fix: unless your doctor explicitly tells you to pause a medication, take all your prescribed medications as usual before your test. Carry a full list of what you take, including dosages and timing, in case the lab staff or your doctor has questions. Error number 3. Testing while feeling unwell. Even mild symptoms, like a scratchy throat, nasal congestion, a headache, or a sleepless night, can affect blood test results. When your body is fighting even a minor infection or inflammation, your immune system is working overtime, which can temporarily alter key markers. This includes white blood cell counts, iron storage, inflammation levels, and even blood sugar. In older adults, recovery from minor illnesses takes longer, so test results may reflect stress rather than your normal health. Example: Mr. Lopez, 82, had high inflammation markers. At first, it suggested a serious problem. When we asked about recent symptoms, he admitted he had a mild cold. Waiting a week and retesting returned normal results. Fix: if you're slightly unwell, postpone your blood test by 5 to 7 days until you feel fully recovered. This ensures your results reflect your usual health, not temporary stress on your body. Tip: if this surprises you, type "surprising" in the comments. Error number 4. Taking supplements before the test. Many seniors take vitamins, hair, or herbal supplements thinking they're harmless. While well-intentioned, some of these can interfere with lab tests. For instance, certain hair or skin supplements may affect thyroid, hormone, or heart markers, causing labs to show abnormal results. Example: Mrs. Grant, 70, had confusing thyroid results. Only after she reported her hair supplement did we realize it had temporarily altered the readings. When she paused it for a few days, the results normalized. Fix: stop all supplements 2 to 3 days before your test and disclose everything to your doctor, even if it seems minor. Transparency ensures accurate results. Error 5. Not drinking enough water. Dehydration may seem trivial, but it affects both your lab results and the ease of the blood draw. Low fluid intake thickens the blood, making veins harder to find, which can create falsely elevated kidney markers, red blood cell counts, and other measurements. Older adults often have a blunted thirst response, so dehydration can occur without obvious signs. Example: Mr. Hayes is 75, skipped fluids that morning, and had unusually high kidney markers. Proper hydration not only makes blood draws smoother, but also ensures accurate readings. Fix: drink plenty of water the day before and 2 cups of plain water about 30 minutes before your test. Error number 6. Not reporting all medications and supplements. It's essential to tell your doctor about everything you take, including prescription drugs, over-the-counter items, herbal remedies, or online supplements. Not sharing this information can cause surprising results and unnecessary follow-ups. Example: Mrs. Kim, 65, used a weight loss supplement purchased online. Her blood sugar and liver markers looked abnormal. Only after she disclosed it did the results make sense. Fix: report all substances, even if they seem minor or natural. Your doctor uses this information to give the safest, most accurate guidance. Error number 7. Intense exercise before the test. Vigorous exercise can temporarily raise muscle enzymes, kidney markers, stress hormones, and blood sugar. For older adults, recovery takes longer, so results may still be altered hours later. Example: Mr. Singh, 62, went for a long run before his blood draw. His kidney and muscle markers were elevated, alarming the staff. When retested after rest, everything was normal. Fix: avoid intense exercise the morning of your test. Light walking is fine. Save heavy workouts for after the blood draw. Error number 8. Eating a heavy meal the night before. Even if you fast overnight, a rich or heavy dinner can influence next morning blood results. Fatty foods, creamy sauces, and large portions take longer to digest, affecting cholesterol and energy markers. Example: Mrs. Ellis, 70, had a rich pasta dinner. Her next day fat markers were abnormally high. After a light dinner, her results were normal. Fix: Eat a light evening meal. Lean protein, vegetables, and some grains. Fish with greens is better than creamy pasta or fatty meats. Tip: type light meal if you'll try this tonight. Error 9. Testing too soon after medication changes. If you've recently started, stopped, or adjusted a medication, testing too soon can give misleading results. Your body needs weeks to reach a steady state. Example: Mr. Chen, 73, rechecked 2 weeks after changing his cholesterol medication. Results were misleading. Waiting 6 to 8 weeks gave an accurate picture. Fix: ask your doctor how long to wait after medication changes, usually 6 to 8 weeks. Patience gives reliable results. Error number 10. Testing immediately before your doctor visit. Scheduling a blood test immediately before your appointment doesn't give your doctor time to review results. That means important details may be missed, leading to rushed decisions or unnecessary follow-ups. Example: Ms. Torres, 58, had a check on Monday, but her doctor visit was on Wednesday. Some labs weren't reviewed in time, causing delays. Fix: schedule blood work 5 to 7 days before your appointment. This gives your doctor time to prepare, review trends, and provide the best guidance. Whether it's pure liquid, sharing all tablets, or planning ahead, pick a pledge and write it in the comments. These small habits make a huge difference in accurate results and your overall care. If this video helped, like and share it. It spreads valuable health tips. Subscribe to our channel to join a community focused on healthy living. And share this with someone who might benefit. You could save them from unnecessary stress and tests. Stay informed, stay prepared, and stay well. See you next time.